Welcome, ladies and gentlemen. My name is Denovan and I'm super excited to have you here. And in this session, we're going to be discussing the health benefits and the science behind CBD and how it works, how to use it, what is the science. This is probably going to be the most important video that you've watched this year, in the sense that the science behind this is extensive and it's so under-publicized. People need to know the benefits. They need to know how the body works, the immune system works, enough so that you can just understand why you've been missing this vital nutrient and it's been literally suppressed from you. But ultimately, it's a life-saving nutrient. So you'll understand then, after you've watched this, the importance, and be eager to be supplementing, but understanding also that we can connect you to the highest quality of products, of course, for very affordable prices, but how we can also connect you and others that you know to get these products for free and actually generate a very generous second income. The bigger picture is that this is the fastest growing industry, and certainly was before this pandemic hit, but it's ultimately going to be a $1 trillion industry, especially as there's so many different medicines that can be created from CBD and these other cannabinoids, as they're known, but also because there's 25,000 different products that can be made from hemp. Hemp is an amazing plant. So by the end of this, you'll understand the bigger picture and what we're working towards behind us using this platform and this partnership that we have to generate very significant sums of income with tactically, strategically entrepreneurial people that can then invest with us to then become the largest growers, producers of hemp, industrial hemp, CBD oil products, and also then a supplier of a huge range of sustainable, highly sustainable products derived from hemp. So first of all, we're going to discuss the differences just between hemp and marijuana, so you can understand that, because a lot of people get confused between the two. They're both part of the cannabis family of plants, but they're very different plants. So just like lemons, oranges, and limes are all part of the citrus family, but are very different fruits. And hemp is very tall and lengthy, grows to about 20 feet tall, and hence it's got this huge range of industrial uses and been amazing for textiles and fibers. And it's got very high concentrations on the active compound that's very, very now scientifically understood to be very powerful, which is CBD. Completely non-addictive, non-psychoactive. You cannot get high. You can have as much as you want and you would not get high from it. It's impossible. Okay, and we're here to get healthy, we're not here to get high. Now, its sister plant, on the other hand, is marijuana, and that has high concentrations of THC, which is the molecule that's now recognized, understood at federal level to be a drug and is high and can cause potentially psychosis. And so obviously we want to be staying away from that, especially for younger developing minds that are at risk of psychosis from that. CBD can actually be used to treat psychosis. Okay, so lots of exciting science on that at the moment. So there is that can be addressed with CBD, but like I say, we're here to get healthy. So let's not get confused. Marijuana also has no industrial use because it's very short and bushy, grows into about 6 foot high, but you cannot really use it for anything else other than just using it for medicine ultimately. Now, what are cannabinoids? Well, as described, CBD and THC, they're known as cannabinoids, and they're found obviously in the cannabis plant family, along with about 80 to 104 other known cannabinoids. And there are nearly 400 other known compounds that are found in cannabis that are common to all plants, like chlorophyll, terpenes, flavonoids, and plant waxes. And the terpenes and flavonoids are what give the plant its smell, its taste, etc. Those are the essential oils. And cannabinoids and cannabinoid-like compounds are found in a handful of other plants, such as echinacea, flax, common tea, kava, and hops. Now, these cannabinoids are interacting with something that's scientifically understood and proven to be in existence in all of us. All mammals have one of these, and it's an endogenous cannabinoid system. It's actually the largest self-regulating system that we have, and it regulates sleep, mood, appetite, hormone production, metabolism, blood pressure, blood sugar, literally everything. It's influencing something known as homeostasis, which is the harmony and balance of all bodily functions. And CB1 receptors are found throughout the brain and central nervous system. You can see the green dots there, illustrated there. And the CB2 receptors are there to regulate and maintain the immune system. And this system literally starts from as early as the 16th day of gestation, so extremely important for early development. Now, this endogenous cannabinoid system of these receptors is essentially there because we create endogenous cannabinoids, molecules internally in our body that bind with those receptors, and that's how the system regulates is through the binding of our internal cannabinoids. And so it turns out that we can have a deficiency in our internal cannabinoids, especially with toxicity that we're increasingly under threat from in our environment. Stress and all of these other things effectively cause us to then have an imbalance. And so the good news is that we can calibrate this system with plant-based cannabinoids, which are called phytocannabinoids. Now, this science has actually been going on for a long time. This is Raphael Mechoulam, who's been funded by the American government for over 50 years, researching cannabis. And he's the guy that actually discovered and isolated the THC molecule, the one that gets you high, in 1964. And then in 1992, he discovered the first endogenous cannabinoid, which they called anandamide, from the Sanskrit word ananda, which means bliss. So when you get the sensation of pleasure from eating chocolate, it's not the endorphin itself that's giving you that pleasure, although that's a hormone that's released. It's from your endogenous cannabinoid anandamide that passes up through the blood-brain barrier and releases that endorphin and that sense of pleasure. We actually have opiates in our brainstem, which is what gives us pain relief when we do experience pain and then it subsides. That's our natural opiates that are available to our body. And this is what CBD is interacting with naturally in our body to help regulate our sensation of pain, and it does it in many different levels. So again, Raphael Mechoulam discovered the second endogenous cannabinoid in 1995, and he's done an excellent documentary, which you might want to watch, which is about an hour long, which you can watch. And really, it's a crime to see that they haven't been pursuing this on a bigger scale, for medicine, and actually just promoting the benefits for the oil as a food supplement. But of course, it doesn't serve the pharmaceutical industry to do that. So here we have Dr. David Allen, who's a retired cardiac surgeon, but now a member of the International Cannabis Research Society. He actually said the discovery of the endocannabinoid system is the single most important medical scientific discovery ever, and will save more lives than the discovery and application of sterile surgical technique, which is an absolutely huge statement. Why does he say that? How did he get interested in it? Well, as a cardiac surgeon, he understood this pattern, which we're just about to look at, but you can watch the video where he talks a little bit about the endocannabinoid system there. As well, there's other doctors in this video talking about it and giving you, again, a bit more background into it. Very, very interesting videos, well worth watching. Now, this US government pattern is what got Dr. David Allen really interested, because he understood it. It's a very in-depth pattern. We've just got a very basic summary here. Which states cannabinoids as antioxidants and neuroprotectants. It was awarded in 2003 to a team headed up by Nobel Prize winning laureate Dr. Julius Axelrod. So it's been known even back then how this could be used. CBD cannabinoids could be used and be useful for the treatment of a wide range of oxidative related conditions, such as ischemic, age-related, anti-inflammatory and autoimmune diseases. Now, my father, actually had two major strokes in his life, one that he made quite a good recovery from, the other, which really did cause him a lot of debilitation. I just wish he knew about cannabinoids, because actually by regulating our system and reducing our blood pressure and blood sugar and all of these sorts of things and reducing inflammation, so many people can have these conditions avoided if they just look at, things that they can do to actually and understand the science behind the immune system and reducing, stress on the body. But again, it's a neuroprotectant. CBD and these cannabinoids are a neuroprotectant. Here again, it says in treatment of neurodegenerative diseases like Alzheimer's, Parkinson's, chronic traumatic encephalopathy, CTE, which is from repetitive concussions and brain injury. So lots of high contact sports players, boxers, rugby players, football players, American football players, are getting this condition. Again, it's not being endorsed by the FDA and the NHS. Doctors, most of them don't understand anything about the endocannabinoid system, so they can't endorse it. Of course, as a food supplement, the quality is really, really important. Understanding how to use it so that you get the benefits is really important. And this is just being missed, and they're just not publicising it, and it's a real crime, because literally lives could be saved by people just understanding this information, taking the products as a supplement. It's just really, really important now that you understand this so you can actually share it with other people and help connect them to this information. And then even if you want to buy the products that we've got, if you went somewhere else, as long as they're high quality and they're safe, then you're going to be doing yourself a lot of good. But that's the issue as well as the quality, and that's why we'll come on to that in a bit. This guy is from Canon Life Sciences, again, talking about the science, again, about how it could be used for pain. There's a scientist in there talking about that. Again, very interesting, just a few minutes, that clip. And they're talking in this video, this news broadcast, about people using CBD to treat dementia and Alzheimer's with great results. Lots of research available, 20,000 studies have been done, pretty much, mostly preclinical. There's about 1,200 peer-reviewed studies that have been done on CBD alone. So again, there are places that you can sort of source information, even just putting in independent science and the health condition CBD into Google will actually bring up, science that you can look at if you want to. The backstory of hemp is huge. It's really, really interesting. It's quite important to also familiarize yourself with that, because then you can understand, again, the fact that basically hemp was the primary source of 90% of medicine derived from hemp up until the early 1800s, 1900s. It's recognized to be really important for medicine. Of course, pharmaceutical industry really started taking off, in the 40s upwards. But before that, there was all kinds of other industrial interests that were under threat by hemp. And so that's really why the prohibition of cannabis happened. And the prohibition of alcohol was even linked to this, believe it or not. So again, you can do your own research on that and just have a quick look at that slide there. But this guy talks about how prohibition of alcohol was to stop Henry Ford from producing ethanol-derived hemp biofuel, because he was supplying 25% of the US fuel market, Midwest of the US fuel market, with hemp-derived biofuel. So Standard Oil, Rockefeller, they funded ultimately the prohibition of alcohol to stop him. So how much CBD per day? What's the guideline? Well, here's a guideline. Now, these statements are not evaluated by the FDA because the FDA is ultimately funded by the pharmaceutical industry. I say probably, they are. Anyway, the recommended daily guideline for a healthy person is 50 milligrams per day. 1,000 milligrams per month of CBD then is beneficial for regular monthly use. If you took 50 milligrams a day for 30 days, then you're going to be getting, not quite, it'll be a bit more than 1,000 milligrams per month, but 1,000 milligrams is somewhere you can start with. And that will help many people with mild or no pre-existing conditions. Just reduce whatever inflammation they've got in their body that could be there, toxicity, help strengthen their immune system, but also improve their alertness, improve their energy levels, their sleep, their muscle recovery. So for those suffering with pain or other health conditions, like including obesity, because you're a bigger person as well, you will require higher dosage than that, much higher dosage if you're to actually try and combat problems already, existing ones. So 50 to 100 milligrams per day or even more is often necessary. But 50 to 100 milligrams, that's like 150 milligrams to 3,000 milligrams at least per month. And what will work for you in terms of your dosage is very specific for you and your endocannabinoid system and your deficiency in your internal endogenous cannabinoids production. So everybody's receptor sites are expressed differently. If you're somebody that experienced cannabis recreation at any point in your life, you're more likely to respond more quickly to the cannabinoids when you're taking them as a supplement, because you've actually increased your number of CBD or CB1, CB2 receptor sites, because the longer you use it for, the more your body creates these sites and the more quickly it interacts. So those that are suffering with cancer, often will find 300 milligrams per day very beneficial, to support their chemo, but also just a lot of people have found that it's actually, they've recovered. They've not just relied on CBD, they've looked at other things to do with their actual environment and how to reduce stress and improve sleep. But the sleeping is one of the first things that people notice. So some people reporting cancers and tumours, literally disappearing. So usually it's worthwhile taking, if you've got cancer, 3 tablespoons of organic coconut oil as well. You might not want to start with 300 milligrams. Some people do. Big American football players, of course, they're big. They've got lots of concussions and stuff like that, and they're big guys, with pain and stuff like that. So they often do start like 200, 250 milligrams straight away. But if you want to just start 50 to 80 milligrams and work your way up, it's usually not best to take CBD too close to bed. Instead, sometimes I would say better to have it 3 to 4 hours before. But try it, see how you go, because some people do find that actually having it an hour before bed or even directly before bed, they get an even better night's sleep. But you've got to see what works for you, because some people find it gives them too much energy if they have it too close to bed. So how to take CBD drops? Well, we're talking about CBD drops, which you've got different forms of CBD you can take in food and capsules, etc., etc. The best way to take CBD drops is actually under the tongue and hold it there. You get higher absorbency into your body because as you swallow the CBD, if you just swallow it directly, your gut and your enzymes in your gut are going to break down a lot of the CBD, so you're actually not going to get as much going to the receptor sites. So if you take it under the tongue, you get about 30% more availability to your body. Hold it there for 1 or 2 minutes. There's a thin membrane there. It sort of absorbs in and swirl it around your mouth because you've got receptors in your mouth as well, and then swallow. It works well to take, 1 serving in the morning and then 1 in the evening. But you might like to try regular smaller doses. That might work better for you. Like I say, it's completely unique for you. How it works for you will be different from how it works for the next person. And if you are taking larger servings, it's always best to probably take those after a meal, especially as the products are mixed typically with a medium chain triglyceride or a coconut oil, so an MCT oil. So that having oil in an empty stomach doesn't agree with everybody, So what to expect? Well, if you are already well and without symptoms, then you'll just find, heightened muscle recovery, more energy, heightened alertness, which is never a bad thing. And improved sleep is the most common first improvement that people notice. Some people may need to take up to, like I say, 100 milligrams per day, though, for 2 to 3 months before noticing a worthwhile subsidence in symptoms for their illness. And remember, some people are saying, big people might even need 200 milligrams a day. Yeah, and it is safe to take that kind of level of CBD. Of course, you might have an intolerance. There is a possibility. Some people are intolerant to vitamin A or other vitamins, in fact. If you do notice any intolerance and stop taking it, depending on the intolerance, then you can obviously just wait a couple of days and then try a smaller amount and see how you go. Your body's going to go through possibly an adjustment as well. Some people are not used to taking something. The body has a response to that, but then after a while, that sort of slight response that wasn't perhaps desirable or one that you would have been considering a benefit will subside, and then you'll just get the benefits. But if you obviously notice an intolerance that is quite, one that you're concerned about, then obviously stop and look at maybe another way. You could try taking it as a product on the skin, because you've got receptor sites on our skin, etc., and it still gets into the blood, from that way. So obviously mixing up taking products under the tongue and on the skin, internally and externally, is a good way to get a full sort of blanket protection and application of CBD as well. So there's 50,000 uses of hemp. It's an amazing plant. Got all of these different uses: textiles, plastics, construction materials, live feed, fuel, nutritional supplements, obviously, medicines, essential oils. So what we're talking about with hemp is $1 trillion industry there in the making. Already $1 billion industry, and it's rapidly growing, and it's going to grow even bigger. Of course, they're looking at these cannabinoids for a broad range of different conditions. You'll see that if you watch any of those other videos on this page here, that there's such a huge scale. They literally could be making so many different medications out of these cannabinoids the more they understand them. The question is are the pharmaceutical industry going to go and do that research? Because ultimately, what we're talking about with the food supplements here is preventative, and people just, taking these products can actually prevent a lot of diseases, prevent needing pharmaceutical medication. So unfortunately, we're living in a world where people, obviously, industry wants to make more money, and so there's more money to be made in medications that you can create and synthesize and patent, etc. Not always good for us, though, right? So what's the importance of quality oil? Now, not all CBD is created equally. It's like a minefield out there. You can buy CBD oil from, everywhere practically these days, even from petrol garages. They're selling it in vaping liquid. Now, hemp is a bioaccumulator, so it's actually really effective at removing contaminants from the air and soil. And plants were shown to be effective in cleaning the soil around the site of Russia's Chernobyl's nuclear disaster, and even considered for the Fukushima disaster there. So, of course, if it's used, then it can clear toxic waste. The last thing you want is contaminated oil. So heavy metals also are abundantly around us. They're in the air, they're in the soil, and we're always going to get traces of those because of that. But it's very effective at drawing out heavy metals. So if there's farmland and industrial places nearby, of course, where the hemp's being grown and then CBD is made from it, then there's risks there. So, and they will get into the plant. So it's really important that you take high quality oil. And the great news is again, our partnership, we have, you know, third-party tested products. They test it through soil to sale, so make sure that there's no contaminants in there. In 2018 as well, just a lot of the products out there that were tested just had no CBD oil in there. So, I mean, that really is, you know, even if you're getting a cheap product and you think, oh, that's cheap, well, if you're not getting the CBD, then it's a waste of money. If you're not taking enough, if you don't understand how to use it, then it's a waste of money. And even worse, a lot of those products, 37 out of 41 that tested didn't have close to what the CBD on the bottle was saying, also had contaminants in there. And E. coli and salmonella can get in there and that can literally kill you. So always be sure that the company you're taking product from has third-party test analysis certificates, so you can check those. And we've got those on our with our company, so you can check those. We've got them for every single product we have that's got CBD in there. That's not to be taken internally there. Okay, so just gives you an example. You can sort of see everything in there in terms of residual solvents, because the way that the oil is extracted as well is another factor. There are cheaper extraction processes, which is why some of the products out there, they're using solvent-based extraction, which is cheaper, but it leaves toxic residues in the product. So you want to be using a company that ideally uses ethanol or even better, CO2 supercritical extraction using carbon dioxide and heating it to actually extract the oils out. So again, these are processes, again, that we know about, we're learning about, educating you about, and again, tapping into the industry in the future. We're wanting to grow hemp, create huge amounts of entrepreneurs, networking, and just tapping into this income opportunity and learning about what we're doing, and then joining us in the opportunity to be the biggest growers of hemp, and then obviously create byproducts from that. We can create the FTSE 100 company of the century by all just using this as a platform, which is an entry point that's so accessible for everybody. I mean, most people can afford £50 a month to invest in their own health. You do that, you find 10 people to do the same, and they do the same. Before you know it, you're making a lot of money, 7-figure income. So right place at the right time, that's for sure. But again, that's all about the opportunity, of course. Again, just looking at this example on a biojournal, again, it says here about the modulation of oxidative stress and lipid peroxidation by endocannabinoids and their lipid analogues. Well, that doesn't mean anything scientifically to me because I'm not a scientist, but I was quite interested when I just saw these things which I've highlighted. Oxidative stress, ultimately several pathologies including cardiovascular, renal, neuropsychiatric and neurodegenerative disorders, then underlining the endocannabinoid system, ECS, which we've been talking about, and redox homeostasis impairment appears to be crucial. And this is, again, you know, lots of studies out there showing very exciting preclinical potential, but people have been taking these products, health supplements, for over 10 years with incredible benefits. I've had a life-changing experience myself and met many other people as well. So very keen to have you try the products just even as a supplement. And if you're taking a small amount as a supplement, it's not going to be breaking the bank, but obviously like £50 a month, you can just tap into what we're doing and help other people tap into it, and we can do something amazing for the world. So I want to thank you for your time. Thank you so much. It's been great to have you here, and I look forward to seeing you on the other side. Take care.